Hi, my name's Anna Harper. I'm in Advanced Health Assessment, and this is my patient, Steve. He's a 32-year-old male who is going to help me with my neuro assessment today. So with neuro, you really start examining the patient and assessing the patient for neuro issues as soon as they walk in the room, or as soon as you walk in the room. And then that is assessed throughout the whole entire visit, unless something specific comes up, and then you would do a focused neuro exam. So what we're going to do first is test the cranial nerves. There are 12 cranial nerves, and we're going to go through each one specifically. The first is the olfactory nerve, which tests for sense of smell. So some alterations can happen with this test if the patient has allergic rhinitis or is a tobacco smoker. So today, for the use of this video, we're going to use 2 different essential oils while we test for the olfactory nerve. So I would like you to close one of your nostrils and smell, and tell me what that smell is.
Orange.
Okay, correct. And the other side?
Peppermint.
Perfect. So next, going on to the optic nerve, we're going to use some of our tests that we learned in the head, ears, nose, and throat section. We're going to do the confrontation test and then look for the red reflex and the ocular fundus with the ophthalmoscope. So cover one of your eyes and tell me when you see my finger.
See.
Okay, and cover the other eye.
See.
Okay, perfect. And you should see your finger when the patient says that they can see it. We're now going to look at the red reflex and the ocular fundus. Have the patient look at this ear. Okay. Perfect. Next, moving on to optic nerves 3, 4, and 6, which are all tested kind of together. The ocular motor, the trochlear, and the abducens. So with this, you're going to do the 6 cardinal fields of gaze, check pupil size, shape, response to light, and accommodation. So I want you to follow my finger with your eyes only. Okay, and then we're going to use a pen light to check pupil size and accommodation to light. Just look straight ahead. Okay, pupils are equal, reactive to light. Next, we're going to check cranial nerve number 5, trigeminal. We're going to, for motor, going to palpate the temporal and the masseter muscles as the patient clenches, and we should feel those muscles kind of tighten up. Perfect. Sensory-wise, for the trigeminal, we're going to check sensory with using sharp, dull, and light and pressures, and we're going to check the forehead, cheeks, and the chin. And I want you to close your eyes and tell me what you feel.
Sharp. Light. Light. Dull.
Perfect. So all those checked out just fine. Number 7, the facial. We're going to have motor-wise the patient frown, smile, raise your eyebrows, close your eyes tight while I try to open them. Okay, show me your teeth and puff out your cheeks. Perfect. Next, we're going to, sensory-wise, for the facial is only tested if you suspect a facial nerve injury, and with that you would test sense of taste with sugar, salt, and or lemon. Next, number 8 is acoustic. We would do the hearing test, the whispered voice, the Weber, and the Rhine. So I would like you to cover your right ear. I'm going to whisper a set of words or numbers, and you tell me what you hear. B.
B.
8.
8.
Perfect. And then we're going to do the Weber test. I'm going to put this on top of your head and you tell me when you stop hearing it.
Stop.
Okay. And then the Rhine test, we're going to check bone conduction versus air conduction, and air conduction should be twice as long as bone conduction. Tell me when you stop hearing it.
Stop. Stop.
Okay, perfect. Next, we're going to move on to cranial nerves number 9 and 10, the glossopharyngeal and the vagus. We're going to have the patient stick out their tongue, and while we assess for the gag reflexes, they say ah. Perfect. Sorry about that. Sensory, you would check for taste in the posterior 1/3 of the tongue. You can put something salty back there to make sure that they can taste it. Next, we're going to do number 11, spinal accessories. So I'm going to apply some tight pressure against the patient's face and have them turn their head to the pressure. Okay, good. And you should feel them pushing a good amount towards you. Then we're going to put resistance on their shoulders and have them lift up their shoulders and do the shoulder shrug. Perfect. Next, and lastly, number 12, hypoglossal. We're going to have the patient stick out their tongue, move it from left to right. Perfect. And then we're going to say light, tight, dynamite.
Light, tight, dynamite.
And all of those should have distinct sounds. Next, we're going to check the cerebral function. We're going to touch our thumbs to each finger, and we can speed up as we go. Perfect. Now you're going to take your finger and touch your nose, and then you're going to touch my finger and go back to your nose. Perfect. And lastly, the heel to shin test. For video purposes, I won't really show it to you just so I don't have to move the camera up and down. But you would have the patient put their heel to the top of their shin by their knee and go all the way down to their heel. And that should be steady and slow movement. Next, we're going to check for balance. So we're going to have our patient stand up. Put feet together, arms at the side, close your eyes, and we're going to assess for any movement or swaying. You want to make sure to stay close to your patient in case they do fall, and a slight sway that we're seeing here is a normal finding. So you can go ahead and sit down. Checking for gait, for posture and rhythm. We want the patient to walk around with no shoes on, and the patient's gait should be smooth, regular rhythm, and symmetric. Next, we're going to check sensory function. For primary sensory function, we're going to do the feet. I'm going to move the camera. We're going to do the touch test with a cotton wisp and have the patient tell me when it's felt.
Feel.
Okay.
Feel.
Okay, perfect. And then assess pain. We're going to use something sharp and have the patient differentiate between sharp and dull when felt.
Sharp. Sharp. Dull. Sharp. Dull.
Perfect. Next, we're going to check the vibratory response of the sensory function. We're going to use the stem of the tuning fork, and we're going to put this over toe and finger joints, shoulder, wrist, shin, and have the patient tell us when they can feel the buzzing. So we're going to do the feet and hands first.
Feel it. Feel. Feel it. Yeah, feel it. Feel it.
Perfect. Next, we're going to check for stereogenesis. We're going to put a familiar object in the patient's hand and have them tell us what it is that they're feeling. With their eyes closed.
remote, bobby pin.
Perfect. Next, we're going to check a 2-point description. We're going to alternate between touching the patient with one object or two objects and have them tell us whether they feel one or two objects. So we're going to check his feet.
Two, one, one, two.
Perfect. Next, we're going to do graphesthesia. We're going to draw a familiar number or letter in the patient's hand and have them, with their eyes closed, tell us what we are drawing.
8. A.
Perfect. Point location, we're going to have the patient close their eyes, touch a place on the patient's body, and have them point with their eyes closed where they felt that touch. Perfect. Next, I'm going to talk about abdominal reflexes. With the abdominal reflex, you're going to stroke each quadrant in from the umbilicus out, and with those strokes, you should have see a slight movement of the umbilicus towards those different positions of the quadrants. The charismatic, it can be tested in males. You would stroke the male's inner thigh and expect testicular and scrotal movement upward slightly. Next, we'll do the plantar reflex, which is positive there. And now we will go over the reflexes. My reflex hammer. We're going to check the biceps first. So we're going to have the patient flex their arm towards us and place our finger over the tendon, and we are going to tap our finger. And I felt a 2+ slight reflex. Next, we'll do brachioradial. Perfect there. Next is the triceps. So we're going to have the patient and tilt their arm like this. Perfect. And next we have the patellar, which is known to everyone. I'm going to have you pull that up here. Slight reflex there. 2+ is always normal. We're going to check the Achilles. I don't know if you can see. Here we go. Perfect. And then for any reflexes that are hyperactive, you can test for ankle clonus to notice any rigidity or jumping of the tendons there. And that is all. So thank you for watching and have a great day.